Hello, Mrs. Head. Share with us today what disease or illness or disability has impacted you or your family.
My husband Bob has prostate cancer.
Tell us more about prostate cancer.
Prostate cancer is a form of cancer that usually starts in the gland of the cells of a man's prostate. Prostate cancer is the most commonly diagnosed cancer affecting U.S. men today. 1 out of 7 men will get it.
Wow, that's quite a high statistic. Well, tell us how you first found out that your husband had prostate cancer.
We went for a physical because he had a PSA test that was a little bit high. So then we got scheduled with a urologist. A PSA test is a blood test, and it is prostate-specific antigens that they actually look for. Once they found that he had that, they had him do a biopsy. And a biopsy is taking cells from the prostate. A lot of his cells were full of cancer, so then they knew that we had to follow with treatment.
Okay. What are some challenges that you've faced on a daily basis?
Well, some of the things that we have gone through are hormone therapy, and he had radiation, and he had surgery. On a daily basis, now it's tough for us to go through the hormone therapy. He's tired, he's very forgetful, and he just generally is achy all over.
Wow. So, how would you say this has changed your life? Not just your husband's, but yours too.
I've become more empathetic to individuals and families that have any type of health problem or situations going on in their lives, because I realize how it changed our lives. I have started reading everything I can about his cancer, and we go to a prostate cancer support group. There are helpful things and resources out in the community, and I've just realized that sometimes we need to tap into those when we have the opportunity.
What would you say has been the most challenging part of this all?
Living with the side effects of the radiation and now the hormones, because the person that I once knew is completely different. The hormones that he's on change his thinking. We go through roundabouts and we forget to get out in one of the areas. We lost and found 3 pair of sunglasses over the summer. So things are just really, really different around the house.
I suppose those things that we remember that you take for granted every day aren't come so natural for him.
Exactly.
Okay. What do you wish everyone would know about prostate cancer?
Make sure that you or a loved one have a checkup. If you have, I didn't know this, but if you have breast cancer in your family and it's lymphatic, there's a chance of you having prostate cancer at a higher chance and earlier in life. And the higher the stage, the more cancers you already have in your life. We didn't know that before.
So any kind of cancer in your family history puts you at a higher risk?
Breast cancer or prostate cancer puts you at a higher risk.
Those two connected.
Mm-hmm.
Okay. Well, what can other people do to support those with cancer?
There is a Live Strong program available through the YMCA, and they allow people to go and do exercise programs with a trainer for 15 weeks, and it's all free, and you get to go with a loved one. So if you want to go mother and daughter, spouse, father and son, it's a really neat program.
That's a neat option. Great. Is there anything that the rest of us can do to help support these people?
I think never give up hope. Realize that the medical field is always changing. So hopefully if one type of therapy doesn't work, that another one is right around the corner. They're doing experimental drugs all the time on all types of cancers, and just stay hopeful and stay connected with one another.
Well, thank you for sharing this with us today.